So thanks so much for all of you for joining us. I'm really excited about this conversation to talk about VCU School of Dentistry, or at what was then known as the Medical College of Virginia College of Dentistry. First African-American or Black graduate, Dr. James Avery Booker Jr. And I'm privileged to be in conversation with his daughter, Dr. Karla Booker, this afternoon to really lift his legacy and talk about and celebrate him, his legacy, his family, all that he cared about, certainly as a career and storied physician, as the first Black graduate in terms of his dental degree. I want to start by just reading briefly a little snippet from this book by the name of Caste, The Origins of Our Discontents, which is by Isabel Wilkerson, who is a Pulitzer Prize-winning author. But she has a chapter that introduces, the book is all about racism in the United States, particularly in the history of race and the comparison of race in the US to a caste system. And she makes—
Can I interrupt you first,
yeah,
Carlos?
Sure.
Can you introduce yourself?
Sure. Yeah, that's fine. So my name is Carlos Smith. I am a faculty member at the School of Dentistry.
Dr. Carlos Smith.
I'm Dr. Carlos Smith. I'm a faculty member here at the School of Dentistry. I'm a general dentist, and I am our Director of Diversity, Equity, and Inclusion, as well as our Director of Ethics and Professionalism. I'm a general dentist. I'm also a Hamptonian, like Dr. Booker and the senior Dr. Booker that we're celebrating today. So happy to have this pirate conversation here as well.
Yes.
Yeah.
I just had to laud you, man, because I'm just so proud of you. And it's no coincidence that you get to be the one to bring this forward.
Yeah, I'm excited.
His name. I had to, you know.
I joined the faculty here in 2015. So I didn't attend dental school here. I went to the University of Michigan for dental school. And I am a history buff kind of just by nature. And so when I first started here, I was kind of asking, I had heard of the legend that is Dr. Francis Foster and had met some of the earlier graduates, but was kind of probing and saying, well, who's the first? And there wasn't a lot of conversation about it. Right. And I didn't know if it was something, obviously there's some reasons that we'll get to, that your father maybe didn't necessarily look back in some pleasant way at his experience. But I was probing and asking, and so it just really happened organically. That I wanted to do something, and then you wanted to do something, and then we were able to connect. And this is the first, maybe in a line of things that we might be able to do that lifts your dad's legacy. So I'm really excited to do that and be a part of it.
So sorry to have interrupted all about Isabel Wilkerson, but I just needed you all that are here to know exactly who you're talking to. This is a bad mamma jamma here. This is
no.
Powerful young Black man, and I am proud.
Well, I appreciate
in this conversation with him. So,
so she has this introduction that talks about the vitals of history, and it says and I think much of our audience is healthcare related or in the health professions, in dentistry, in medicine, or somewhere adjacent. So, but all of us have been to a doctor, certainly, right? It says when we go to the doctor, he or she will not begin to treat us without taking our history. Not just our history, but that of our parents and our grandparents before us. The doctor will not see us until we have filled out many pages on a clipboard that is handed to us upon arrival. The doctor will not hazard a diagnosis until he or she knows the history going back several generations. As we fill out the pages of our medical past and our current complaints, what our bodies have been exposed to, what they have survived, it does us no good to pretend that certain ailments have not beset us, to deny the full truths of what brought us to this moment. Few problems have ever been solved by ignoring them. Looking beneath the history of one's country is like learning that alcoholism or depression runs in one's family, or that suicide has occurred more often than might be usual, or with the advances in medical genetics, discovering that one has inherited the marker of a mutation for breast cancer. You don't ball up in a corner with guilt or shame at these discoveries. You don't, if you're wise, forbid any mention of them. In fact, you do the opposite. You educate yourself. You talk to people who have been through it and to specialists who have researched it. You learn the consequences and obstacles, the options and treatment. You may pray over it or meditate over it. Then you take precautions to protect yourself and succeeding generations and work to ensure that these things, whatever they are, don't happen again. So I thought that was just a fitting introduction to talk about our first African-American or first Black graduate of the School of Dentistry here located in Richmond, Virginia. I think that's important to lift up in terms of percentages and representation and a history of slavery and the Confederacy and all kinds of things that really dovetail and kind of conflate and are very layered into what the Medical College of Virginia and the VCU history looks like and is. So I'm so happy to have Dr. Karla Booker here. I do want to just briefly read a brief little excerpt about your dad so that everyone can know a little bit of his history, and then we'll get into the discussion.
Okay.
He was a native of Richmond, Virginia, born in 1936. He graduated from Armstrong High School in 1953, Hampton Institute, now University, in 1957. He distinguished himself as the first African-American graduate of the Medical College of Virginia School of Dentistry in 1961. So this year would have been a commemoration or his 60th reunion, where he's still with us today. After years of private practice and teaching at Howard University College of Dentistry, he began his lifetime career in medicine at Howard University School of Medicine, graduating in 1968. So I just want to park there for a quick second, that this man completed 2 healthcare professional degree programs.
He did.
2.
He did.
And that would be outstanding to do one, but to have completed both and academically shine as well. He didn't struggle through. I just wanted to lift that point up too. He began his lifetime career in medicine, completed an internship in public health service in San Francisco, completed his residency in general surgery, also a particularly demanding field in California's Veterans Administration System. He was board certified trauma surgeon and was elected as a fellow of the American College of Surgeons, as well as the American College of Quality Assurance and Utilization Review. He had many successful years of private practice. He also practiced as a flight surgeon in the United States Air Force and Reserves, retiring as a colonel in 1996. A legacy of medical education as an assistant professor at the Martin Luther King Charles Drew School of Medicine in Los Angeles, where he also served as medical director. He even served as adjunct faculty at Tulane University School of Medicine. Surviving Hurricane Katrina, he relocated to California and was still active in the state as a medical consultant. That is the life of Dr. James Avery Booker Jr., and I'm joined by his daughter, Dr. Karla Booker. So excited to have this conversation. Tell us about your dad and, what you want to start with, his upbringing in Richmond.
Okay, let's start with that. So very unusual, I'd say, in my family. Both my maternal and paternal grandparents are college educated. My grandmother, my dad's mom, went to Virginia Union. She was a teacher in the public school system there, Baker School. She dedicated herself to really lifting up kids who had nothing. So she taught the poorest kids at Baker School in Richmond and talked about that. She was very specific about who we were around, who we spent our time with. Very much that way with my dad. I've heard people that were raised with him, his cousins, say that he dressed impeccably. She dressed him impeccably. He couldn't just play running around in the neighborhood. Very much church-going people. And I think it was because, just as it is today, as a Black person in the South, I would say, my dad was at risk. And he was precious to her. He was her only child. My father was an only child in 1936. And therefore also her firstborn son, her only son. And he was very bright. So she shielded and sheltered him a lot. And he didn't like that. I remember him telling me that. He wanted to be running around and playing with other kids. He took piano lessons. She was very specific about homework. She was very strict. And he had a very strict, very disciplined upbringing. And that, of course, I think, held him in great esteem as he went on further in life. He did everything he wanted to do. He did it. So I remember my grandmother had all of his stacks of college admission letters, Morehouse and Clark Atlanta, and even as far as Prairie View. But she wanted him to stay in the state, and he went to Hampton. Grandmother was a graduate of Virginia Union, and she knew she didn't want him to stay in Richmond, but he stayed in Virginia and went to Hampton. So yeah, Richmond was really something. Was raised in Church Hill, which of course was the Black side of town then. Very, very segregated. At Armstrong High School, again, a Black high school on the Black side of town. And he did well. I don't recall him saying he was an honor student or anything like that. Mm-hmm. I don't remember that until he got to the dental school. He was not even an honor student at Hampton. But he, I think it takes something, and so, I guess you can ask him about that. But Richmond, for him, his upbringing was very strict, was very isolated. He was a bright young Black male. And I think my grandmother knew that was special and that she had to protect that.
One of the things that, I think is so rich in terms of, I'm from Columbia, South Carolina. So even my father went to segregated schools. My father's 70 years old and went to segregated schools. So one of the things that I think is rich, though, about that fact is that I think it's so important that when we lift the narrative and we celebrate different individuals such as your father, we want to talk about, the racism they endured, the segregation they endured, some of the challenges that they overcome, but that in and of itself doesn't define, who these outstanding type of people were. That That's even right. though they had those challenges, they were excellent and excelled outside of the racism that they faced. Yes. And so did he ever talk about kind of the days of his high school upbringing or like being in segregated schools and what that felt like for him or anything like that?
No, the only real conversation I remember having with my dad about his interaction with white people was that he was a newspaper boy. So he threw newspapers. And I think the conversation we had was, you knew what was expected of you. You knew what was expected of you. When I read the line that I guess that one of my father's white classmates at MCV talked about him being a humble man and a quiet man and a diligent, hardworking man. My daddy was not quiet. My daddy was, I'm sure that my being as outspoken as I am comes from him. He was very outspoken and boisterous and very fun-loving and, would very opinionated and would directly tell you what he thought. But, that was not being a good, I'll say, Negro back in those days. So isn't it interesting that who they saw was who he needed to be in order to manage what he had to manage every day to stay successful and probably not to lose his mind, so, and my grandmother the same way, was a very outspoken and very opinionated woman. But when we got into, situations like with her white physician, she cowered and kowtowed and was quiet because that's what it took back in those days to be able to go get home at the end of the day and with your life. You couldn't be outspoken or opinionated, or have much of any colorfulness to you at all. The expectation was you'd, kind of bow and scrape and get along. So I found it interesting that that's who they saw, but then not so much, because I think that's what it took. You would be an uppity NIGGER if you, if you came across as bright. Imagine my father competing academically with these people and them knowing that he was doing better than honestly, than 85, 90% of them. He was in the top 10% or the top 10 graduating seniors in his class. So how intimidating in a day when the whole narrative about racism is to keep people believing that they cannot compete, keep a certain class of people believing that they are not as good as. So imagine, who did he have to be in order to navigate what he had to do each day and do it with excellence and come home at the end of the day with his life?
I think that is so rich, and I think it was certainly, without question, a different set of expectations and kind of a coded life, right? But I think it parallels so much of what we still experience today.
Yes.
Particularly when
Yes.
we continue to read articles, even I think it was in Indiana, about the female physician of color that passed away
Yes.
from COVID-19, and
Yes.
and the apology that came from the hospital system talked about the nurses being intimidated by her.
Intimidated by her.
And so it's fascinating that although we have come a ways, we haven't come a ways.
Correct.
And so that it's just fascinating that like you said, your father's classmates really didn't know him, but it wasn't like he was allowed to fully be himself in that environment. Yeah.
I mean, are we allowed to fully be ourselves as Black people in America today? Are we allowed? And when we are ourselves, the narrative that goes along with it is so negative. I'll tell you, I'm a, highly educated Black woman and practiced OBGYN in the OR and handling my business and running things, chief of the department and all that. And I'll tell you, I was called a BITCH many, many, many times, just because I don't suffer fools. I guess I'd say it like that, as my father did not, and I work now here still in Atlanta, Georgia, and I work in a predominantly upper middle class, elderly white clientele in urgent care. And if it happens to me once a day, it happens to me 25 times a day. These people ask me, they say, "You're not from here, are you?" Now, what does that mean? I'm a Black woman, and I look them directly in the eye, and I say what needs to be said. I have respect for them. I honor them as my client, and I am giving them what they paid for, which is the truth.
Sure.
But I don't kowtow and I don't look away. I look them directly in the eye. I speak my truth directly in the eye with respect. And I don't think that we have been given permission as Black people to be honestly, truthfully, stand in the excellence that we really do inhabit in our bodies and in our spirits. I still don't think we have the kind of permission to do that we deserve.
I have a colleague who actually is at Drew and at UCLA, who is the chair of oral surgery there, Black female. She, in addition to her dental degree and her oral surgery training, she has a PhD. So has checked every box that you're supposed to check. And she wrote a perspective op-ed article in one of our dental journals that was released a couple of months ago, that talked about her experiences when she would go to conferences in such a traditionally white male space, and how she is so often redirected. Oh, this isn't the right room. What are you looking for? As if she couldn't possibly belong in that space.
I'll give you another one. I actually have had my white coat, my stethoscope, my ID that has MD under it, my name, my credentials, Department of OBGYN, and I've walked into a patient's room and they've handed me their dinner tray. I'm just going to leave that right there.
It is a sad collective experience that those remnants, and not even remnants, that minimizes it too much for me, but that some of the things your father would have had to endure, that kind of the grandchildren of that and those issues are still so relevant and prevalent, particularly when we start talking about health inequities and disparities and the controversy that I think it's the American Public Health Association has really defined racism as a public health issue. And there are health professionals who take issue with that.
Social determinants of health. social determinants of health. And poverty is the number one if we go by caste, right? If we do it as a socioeconomic issue, let's just call it socioeconomic, because poor white people also are not doing well. But because the larger percentage of Black people are in a lower socioeconomic bracket, it very much ends up being an issue of color. And so, we've got these stories in our head that, Black patients are going to be more this, they're going to be more that, they're going to be more at risk for this, more at risk for that. It's going to take more thought. It's going to take more time. And then you also take that with the fact that this country doesn't value Black people as they do white. So now I've got a patient that's probably going to be sicker. It's going to take more of my time, more of my intellect. And I've already in my head, I've got a predisposed idea that this person doesn't have the same value. So then you see how that then means that, well, this person's going to take a lot of time and a lot of energy, and they're not really worth it. So I'm going to minimize every symptom and I'm going to get them out the door.
Sure.
That's what happens. And people don't recognize that it's like wearing a rose-colored glasses. You don't realize that what you're seeing is rose-colored because the glasses are on. It's taking those glasses off, and we haven't figured out how to do that. We have not figured out how to do that.
Sure. I think this is rich. I do want to get to some of my questions that I prepared for you. No, this is great. We talked about, I want to put it in the context. So your dad was the first. I know that both the second and third African-American graduate of the dental school were men. And then the first Black female graduate from dental school in the late 70s, Dr. Irma Freeman. They were all products of historically Black colleges or universities. And so I wanted to talk with you. Your father, many generations of your family attended Hampton University, which is obviously your alma mater, mine as well. Could you tell us about what Hampton meant to him and how that shaped him and influenced him?
And I would, maybe this is all HBCUs, I wouldn't know. I know that my friends and colleagues that are products of HBCUs love their school, but there is something special about being a Hampton Pirate. And that for my daughter, Heather, to be the fourth generation of my family, to be a Hampton graduate, to have taken her to Hampton for homecoming at 2 and buy her a Hampton class of 2005, pin in 1984,
Sure.
To have my grandmother see her crowned Miss Freshman for homecoming, and then my grandmother to live to see her graduate from Hampton. So what it meant to Dad was he was everything. He was on Scabbard and Blade. He was ROTC. He was an alpha. He was entrenched in the environment. I'll tell you that what I'll say about Hampton is, it is our home by the sea. You were made to feel at home. You were expected to do well. The dorm director would call you, grab you by your collar and say, Miss Booker or Mr. Booker, what are you doing? There was an expectation of excellence. And I think what it meant to him was he was set up to win. I'm going to tell you, if he hadn't been at Hampton, I honestly don't know if his success at MCV would have even been possible. I think they set him up believing. And you can say, you know this too, Carlos, at Hampton, we believed that we were the best.
Oh, of course.
We believed that we were the best, that we could compete with anyone. And I don't think that at a majority, my friends that went to PWIs will say it in a minute, I wish I reconsidered, because it gave us a place to fall down. At HBCU gives you a place to fall down and people around you to lift you back up and dust you off and put that, that camphofenique on your little hurt and put a Band-Aid on it and give you a kiss on the cheek and keep it moving. And I think when you fall down at PWIs, there is no one. Really, back in those days, certainly would have been no one. And I don't even think today that would really lift you up and dust you off the way that I was dusted off at Hampton and then again at Meharry, which is where I went to medical school. I mean, I went to medical school having had a daughter at 20. She was 18 months old. I was 22. They put me on campus. There was a preschool on campus. I had an advisor. They got me a tutor to pass my boards. I mean, it was about the success for me as a Black person, because I became the face of Meharry. And I know that my dad became the face of Hampton as he went on in his life as well. So that's what it meant to him and to us.
You know, so I want to connect that to kind of an overall arching theme when we think about like the first to traverse the dental program here specifically. And there are lots of firsts in terms of first African Americans as Black History Month that have done medical school at PWIs or different places. What role do you think HBCUs play as we continue to face inequities around representation in all health professions, pharmacy, medicine, dentistry, you know, even some of our kind of allied health, occupational therapists, all these kinds of things. The representation is not really changing from where it's kind of flatlined over the years. What role do you think HBCUs play in continuing your father's legacy and aiding in the elimination of health disparities?
You know, so my dad finished Howard Medical School in '68. And I can remember a lot of his friends that were in residency with him in the VA system in California were a part of affirmative action, right? So affirmative action existed in the '70s to try to even the playing field, because clearly, you know, we knew that coming from an HBCU and then trying to apply to Stanford for medical school, they never heard of Hampton. So there had to be, you know, openings made for people of color. And it made it possible for Black people to then be able to have an opportunity to go to some of these white schools. Well, that was struck down as illegal. I think it was in the late '70s or early '80s. So affirmative action no longer existed. So without that, and it still doesn't exist today, there are no spots left open, no percentage of a class that is then left available in order for there to be equity. That is really what needs to happen. Because that doesn't exist, the only real opportunity that we have in any large number to change this is to have HBCUs, and to have HBCUs have that it be understood the quality that an HBCU graduate has. You know, I think it's happening now with sports, which is really great. Now we see with all the Black Lives Matter stuff, we've got Jeff Bezos' ex-wife giving, you know, hundreds of millions of dollars to HBCUs. Sure. So that's kind of putting us in the forefront. But it's necessary to have an HBCU as a nurturing place for young Black people to be educated, not just academically, but also psychologically, culturally, community. You're just not going to get that at a PWI. And I know that PWIs have, you know, Black student unions and strong Black student government and organizations, but I don't think it's the same as having a place where kind of everywhere you go all day long, the folks look like you, and so you don't have to worry about being Black. That's not the conversation. You don't even have to think about it. Now you can really get down to, you know, finding a good husband or wife, having good grades, having a lot of fun, having a good party at the end of the academic block and the testing. We don't have to think about and deal with what it is like as a soldier in this country walking out the door with Black skin. There's nothing like that.
So I want to continue in that vein, but shift just a little bit. And I appreciate you speaking to that. You know, we're getting some chat and some questions about your dad's specific experience at MCV, right? And so I do want to highlight that. And that's why I started with really trying to frame us in understanding history, understanding the context. And so I know when we spoke before this, that you said that your dad really did not mention, he didn't speak of his time at MCV. And so I wonder if you could just offer some conjecture around why you think that was.
Okay, so you know, it's funny, I really never asked him. I never asked him. I knew that he was the first Black graduate. I knew that he didn't practice dentistry very long. He did tell me that he knew at the end of his first year of dental school that dentistry was not for him. He did not enjoy it. And he continued and graduated in the top 10 of his class because he was the first. And he didn't want the first to have quit. He didn't want the legacy of the first. He didn't want to bar or inhibit any Black person coming behind him. He didn't want to mess it up for those coming behind him. He understood that he was now the linchpin, the cornerstone of people that would then stand on his shoulders. And so he made that sacrifice in order to pave the way for those coming behind him. I talked to my mom about it, I think they got married in 1960, I think she said. So he graduated in 61. So he was living in Richmond at home. I'll tell you this, I asked my mom, well, why did he go to MCV? I mean, he could have gone to Howard, or Mom said he went to MCV because it was a state school, so he would have low tuition. That's why he applied to MCV. It was, I think, the only dental school in Virginia.
Sure,
it was making it easy on his parents financially. There's no consideration that this might be hard, or I'll be the first one. It was going to be a financial good move for his parents. He had a scholarship to Hampton. So what my mom said was she saw him every weekend. She came home from her job every weekend and saw him. And I said, Mom, well, did he talk about how bad it was? Did he talk about them burning that effigy in the lab? Did he talk about? He never talked about it. My mom said that what she remembers about my dad on those weekends was that he was busy. Sure. And he had his nose to the grindstone, and that he was focused. And I'll tell you, that's who he was. And let me tell you another thing. You didn't hear Black people complaining about what they were going through. You just didn't hear that. It would be ridiculous. It was, I think the way that my grandparents talked about racism, it was as a joke. Them folk, how they are. I mean, it was kind of like that. So it would have been unusual to have had him complaining. Even out talking to my grandmother, she was very proud of him. That's all she said. I don't think she would have suffered any conversation about how hard it was. He never talked about it. Mom said he never talked about it. And so his nose was to the grindstone, whether that grindstone made, contusions and abrasions and he came home bleeding was not the issue. That nose stayed to that grindstone. That's what I'll say.
Yeah, so you brought up the effigy issue, right? And so I wanted to talk about that expressly. And I know that sometimes, because I do quite a fair amount of lecturing around medical mistrust and some historical lapses that have happened around experimentation and clinical trials and all these kinds of things. I think sometimes folks, when you're raised in an environment where this is common knowledge, and sort of community talk, when things have happened that we now bring up later, people want evidence, or they want to know, did this really happen? So I did want to just say that in the Richmond magazine, when your dad passed away, actually did a little ode to him and talked about the fact that the dental students, whether they were his class or ahead of him or whatever, did burn an effigy of his likeness in the dental lab while he was a student here. And one of his classmates said, of course, some of them were appalled, but some of them thought, the ones who did it thought it was funny. When did you first learn of that incident? Obviously, you said it wasn't something your dad talked about. How does that make you feel, even as his child today?
I heard about it speaking with, I guess, Miss Barbara, who was, I guess, in diversity, retired last year. When we started kind of talking about, I knew that his 60th anniversary was coming up. And so we started having these really rich, deep conversations about what to do in commemoration for him. And she sent me a lot of documentation, and they had spoken. I guess it was the first 100 Black graduates, wasn't until 5 years ago or something. So we got 55 years for them to graduate 100 Black students in dental school. And one of the people had written something about this burning a Black man in effigy in the lab. And it brought tears to my eyes. And I think about how much he must have gone through all alone. He never spoke to my mother about it. I imagine he did not speak to his parents about it. How isolated he must have been. I asked him, I said, well, Daddy, I think he had to come in through different entrances and exits to the clinic. I can't imagine, would they have allowed him to have white patients in his,
Right.
would he have only had Black patients? Was he able to change clothes in the locker room with the other students? He was not. So I think about the isolation. It would be like being in solitary confinement. And then to have, that's no joke. There was still lynching going
Sure.
on in the 50s and 60s. So his life was in danger, and he was undeterred. So how I felt about that was it brought tears to my eyes, and my heart broke for him. And then I really got, man, the fiber, in my genes, the blood running through my veins is this man who did not complain. He didn't go to administration. He didn't complain about it. He did Jackie Robinson. They picked Jackie Robinson because he could handle it. If you've seen, what is that, 42?
Mm-hmm.
They wanted to be sure that he was going to be the kind of man who would be able to take the lashing, because it was going to come.
Sure.
And not break down, and not get angry, and not retaliate. That's what it took to be first.
I want to lift a comment from Dr. Carmen Foster. She said in 1960, racial tension was tight. 34 Virginia Union students were arrested for a sit-in at Thalheimer's department store. The Black Richmond community called for an economic boycott. Thalheimer's department store lost over $8 million that year. The stores did not open their retail restaurants to Blacks until the day of John F. Kennedy's inauguration in January 61. So Dr. James Booker was a dental student in the whirl of racial change in Richmond during that time. Even today, one of my areas of study in terms of the educator aspect of me is resilience. Why some students struggle or hit a struggle, but are able to bounce back, or some are able to then thrive and go forward. And there's so much documented research about how underrepresented minorities, historically minoritized groups, go through the same experiences, particularly around professional school, but have a totally different experience than their majority counterparts. I mean, that's documented today. So I cannot even really fathom or imagine, you listed out so many things that I think we take for granted. He would have ate lunch by himself. Where would he have even been able to eat lunch? He would have gone to a separate bathroom.
Use the restroom.
Everything.
Imagine that day, in the lab, seeing that burned in effigy. How would you respond? I wonder, he certainly didn't break down and cry. Would he have just turned around and walked away? Would he have ignored it? And then how would you feel then leaving and then having to go home? Would you feel like someone was going to jump you? For how many days after would you feel like your life was in danger?
Sure.
So yeah, resilience, and to have to then go home and study and prepare for exams the next day and prepare for clinic the next day, knowing that your classmates really wanted to intimidate you out of their class. They wanted him to quit.
And for no other reason than the color of your skin.
That's right. And he was excellent. Yeah. I'll tell you one more thing he told me. His grades at Hampton weren't that great. My dad told me he got the second highest score on the DAT, dental admissions test, in the entire country that year. And the dental test, he told me, was very much about spatial relationships. Sure. And that's where he excelled. He said he was the number 2 student in the country that year. And that's what got him in, so imagine that brain academically. And then on the flip side, on the art side, now he has to also understand. My dad told me that the word nigger, my parents told me that when people use the word nigger, I should feel sorry for them because they were ignorant. That was what the word nigger meant to me in kindergarten. That I should feel sorry for the people who used it because they were ignorant. And so the first time a person called me nigger in Marin County, California in 1968 in kindergarten, I told them, I feel so sorry for you. I'm so sorry for you. I was not raised that the word nigger was anything disparaging to me. it was disparaging to the person who used it. So just now, what made me think of that, imagine that the way he was looking at the effigy was really with a sense of sadness for his classmates. Is that possible? Because that's what my parents told me. They moved us out to Lily White, Marin County, California, when he finished medical school, where my brother and I and maybe 2 other Black kids in the entire school. And that's what he told me. I had to be 5 times better than my white classmates. I can remember him saying that to me when I was 3 and 4 years old. And he told me I should feel sorry for people who use the word nigger because they were ignorant.
So I guess what I keep hearing and lifting is this massive altruism and concern for others, right? About your dad. And what is it? You know, I think it's interesting, you know, we have these conversations probably all the time in like pockets and in particular communities, but I think that that word was used with you and that your dad was framing these conversations for you as 3 or 4 or a kindergartner. Also that this was happening in California. I think sometimes people have a selective imagination that this only occurred in the South. You know, how does you think your dad would respond today where, you know, we're still suffering a lot of these health inequities, we're still dealing with social determinants of health, we're still dealing with needing to contextualize race when we look at our curriculums and how we train physicians, and that, for example, Black patients are far less likely to get meds in the ER or meds dispensed to them versus versus majority patients. What do you think his response would be to those that say, can we move forward from race? Can we get over this? Why haven't we gotten past it yet?
You know, I think what my dad would say, and I think what he told us coming up, was educate yourself. Educate yourself, make sure you've got your credentials, absolutely. But also an idea of educating yourself and knowing who you're dealing with. Don't be fooled. I think he would have been very clear that racism is alive and well. I remember when I was a second-year medical student, I wore my hair probably as low as yours is, Carlos. I had a teeny little afro my first and second years of medical school. And my dad told me I had to grow my hair. He said, you know, you cannot move into the hospital, into the clinics, looking this different from other people. And I was like, Dad, what are you talking about? You know, it's like, this is, you know, 1983. He said, Karla, medicine is a white man's profession. You will have a much easier time looking as much the way they expect you to look as possible. And it broke my heart. Like, I was rocking that little afro, you know, I was, you know, very much a woman of the 70s and 80s. And I think he was absolutely right. I love it now that we can't talk, you know, we can wear your dreads, I can have my braids, this whole hair bill that was passed in California. But look at, a bill had to be passed so that I can stand confidently and come to work with my ethnic hair. A bill had to be passed, you know, and I think people still have an idea of what it looks like to them. Yeah, so I think Dad would say that racism was alive and well. I need to be cognizant of who I'm dealing with at all times. Don't be fooled. Don't let my guard down. And that this is still a war and we're still in a race and we're still far behind. Sure. And the way to, he would say that the way to improve and the way to even it out would be to educate oneself. He was a W.E.B. Du Bois kind of a guy. You know, we've got to, in order to compete, we've got to show intellectually that we can compete. It's the intellectual that's going to make a difference for us. Whether it has or not, I don't know. But I think that'd be his number one. You know, have those credentials behind your name.
I think there's a comment from Dolores.
That's my mom.
Is that your mom?
That's my mom. That's my mom.
Yes. So she says, I never knew about the effigy, but I knew that it was a very hard time, but that he needed to continue. I think our weekends were a respite for him. He had a lot of support from his extended family, and that was good for all of us. There was no need to complain, just important to persevere.
Dolores, you're making me cry over here.
So
Yeah.
thank you so much for that,
and
for putting that
and to have her as his wife.
Yeah.
You know, to have her believing in him. And you know, let me tell you, you know, I really think, yeah, my mom, she knows how to hold you down. She knows how to hold you down. And I believe that he did that. She did that for him.
Yeah.
Yeah. Yeah. Hi, Mom.
I mean, that's so beautiful. I mean, again, realizing that he didn't really actually like dentistry, you know, as a first year, it wasn't like it was his third year. You know, his first year, you could have kind of done something else, really. But to really be thinking about those of us that would come behind is just really, really touching.
Yeah. Yeah. You know, it's so sacrificial.
Yeah.
You know, it's not, we're not talking about 1 more year. We're talking about 3 more years.
Sure.
And clinicals. And not just doing it and getting by, not just doing it and getting the degree, but doing it and graduating in the top 10.
Yeah.
Doing it and getting the respect and getting the respect of your classmates. Because what he did tell my brother was that he did feel that he had a couple of friends at the end. There were people that were kind of rooting for him. And he did feel like there was some faculty that was kind of on his side. And Daddy never told me that, but he did tell my brother, who's his namesake.
I think that's great. And I think, you know, all of us that have traversed professional school, you need some of that, right? You need some support. You need some faculty in your corner, irrespective of if they look like you or not. But sometimes that representation certainly is very helpful. And she says, again, he was very secure about who he was and what he could do. He didn't like dentistry, but he was an excellent dentist. He absolutely did his best. So I like that. Yeah.
Oh, thanks, Mom.
Yeah, that's great. But it's all a helping profession, right? Dentists, physicians, we're all in the business of helping others. And obviously that is a large piece of your father's legacy, that we are the richer for him having been here and laid that foundation, and being the first. And if I have something to do with it, that name is going to be known and recognized here, because I think it's important. I think it's important that we continue to lift his legacy and his name, because he really did blaze a trail. And as we think about it, not only just, you know, for African Americans, but all people of color, women,
that's right,
as well. So those early barriers, particularly even at MCV, we've got a strong history where there was discrimination around Jewish students as well. So there were all kinds of barriers that really are the legacy of the work that he endured and the journey he endured, and likely the pain that he endured. So we're the better for it.
You know, I was sitting there thinking of, you know, what is it to be the first? So I'm imagining a cement wall, and I'm imagining a nail, and I'm imagining a hammer. So that's the first. You're making a chink, and then you hit that hammer, and then there are cracks and cracks. And then another person comes behind and hits, and there are more cracks and more cracks and more cracks and more cracks. And then the entire wall crumbles. But that very first one, man, if that first one doesn't happen, the cracks cannot continue and the wall cannot fall. So yeah, absolutely. Yeah,
that's great. Obviously he entered sort of dental education a little bit at Howard. He also was a faculty member as a physician. Did he ever share about why he chose kind of those faculty roles from time to time? Or
so he told my brother that when he knew when he graduated from dental school that he wanted to educate Black people in dentistry. So he didn't enjoy it, but he was good at it. And he wanted to make sure that he passed that education on. So he was in private practice in Washington, D.C., and he became faculty at Howard's Dental School. And then through the dental school, I don't know where this desire to be a doctor thing came from, but it was there.
Yeah.
And I started having conversations with faculty in the medical school. And then of course, dent and medical school students took classes together.
Sure.
And so it was kind of, he said it was a no-brainer for him to just ease himself on into the freshman class as a medical student. I think he must have practiced, finished some, I mean, 68, 64. So practiced for 2 years and was also on faculty at Howard, and then started in medical school the year I was born, 63, 64.
I mean,
and then finished in 68.
It's a dynamic legacy, even as, you know, I'll take a selfish moment as a Black male, as a full-time dental faculty, there are not many nationwide. So that he also was in those kinds of forefront footprints is really rich to me, and really a joy to me, especially the Hampton connection. I'm so excited that this is something we've been able to do and converse about and really lift his name and legacy. Is there something you see as your father's foremost legacy?
Man, I guess I'd say excellence. And I think about, you know, how exacting. He used to take me to the hospital with him when I decided at 11 I wanted to be a doctor, and so he used to take me to the hospital with him. And I can remember the nurses and the residents and the students and his patients just loving him. You know, high respect. The nurses would stand back in the day when the attending would come on the floor, the nurses would stand. So the nurses standing, giving him a seat, working with residents and teaching, had an opportunity to watch him lecture some of my residents. It was a level of excellence and professionalism, and even a different way that he would speak as Dr. Booker than he would speak as Jim Booker, who was cool as hell. You know, loved his Boone's Farm, Strawberry Hill, and a good football game. You know, had a big screen TV before they had them. Loved a good party and just was a really juicy, wonderful, delicious person to be around, and very direct, very exacting, high disciplinarian, but just a level of professionalism that I don't think we really see today. And professionalism in a space of excellence and humanism, because he loved his patients. He said he loved surgery because you could find the problem and go cut it out. No ifs, ands, or buts. Here it is. I can cut it out. And watching him get to be Dr. Booker and Dad, but watch him be Dr. Booker, and that level of excellence and the respect that his colleagues and that his ancillary staff had for him. Yeah, it would really be about excellence.
These are all things that, you know, we're still trying to figure out exactly how we instill that in practitioners today, how we instill professionalism, humanism, really dignity of humanity and other, right? Recognizing and seeing the other, seeing patients and seeing them as human. You know, it's something that, at least in the educational space and curriculum space, like we're still trying to figure out and come up with methods and competencies and ways that we assess all of those things that it seems like your dad really just naturally and organically possessed.
Well, you know, I rounded with him and stuff. You know, he brought me with him and said to these patients, is it okay if my daughter just comes and watches me examine you because she wants to be a doctor? So he was sharing who he was as a father with these, not just staff, but with his patients. That, you know, would you be a part of the legacy of my family? Would you let her watch me do my craft? And so as a physician, I really do share who I am as a person and as a mom with my patients, so that they get this whole dichotomy of who's smarter and who drives a nicer car and who has a bigger house. That has nothing to do with it. You know, what this really is it's really two people. And I think my dad, I don't think he said it to me this way, but I know that the way I feel about myself as a provider of health care is that I am the employee, that I work for my patient. They're my employer. The hierarchy is they come first. And I wouldn't I'm thinking about it right as we're sitting here. That really is who he was. He was very proud of himself as a doctor. He had a little peacock strut to him. But when he was with those patients, they got him. They got some Jim Booker in there. And I'd like to think that I've brought that forward, as a part of his legacy in medicine, that who I am as Karla does come through in who I am as a provider of healthcare.
Awesome, awesome. I think your mom also wanted us to know he practiced dentistry while in medical school as well.
I didn't know that, Mom.
So
Well, dag.
Really outstanding. And then we have one of your dad's classmates is on.
No.
It says his name is Richard. I don't want to mess up the pronunciation. Mariani, Dr. Richard Mariani. He says, I was a very proud classmate and friend of your dad. I am sorry he was not here today to listen to his daughter. He would be very proud. Jim and I studied together in our first 2 years. Your dad always was the most dignified in the room. As you explained, your dad put up with racist remarks from a few of our, what he says here, South Carolina classmates, but with a quiet dignity. I very much love your dad. Thank you for that.
Oh my gosh. Because, Carlos and I, we talked about,
Sure.
I went back and found my dad's yearbooks. You can find the yearbooks online. And I went and looked up a lot of those names, and a lot of those folks are still alive. And I was very curious. So Dr., I don't know the last name.
Mariani.
Did he have to come through different, was he able to be in clinic? What was that like for him? Was he able to dress with you all? Did he have lunch in the cafeteria? Was it as segregated as we know Richmond was? Did he have to come in through a different entrance? Could he take care of white patients? I don't know those things. I guess Dr. Mariani, you would know that. Very, very curious. And I've got to get your information, because I bet you have a whole side to him that I and my mother, would never know.
I'll see if we can, sometimes it will capture the contact information, but I'll definitely get with Alumni Affairs and make sure we can get you connected with him since he's on the call today. Thank you so much for that, Dr. Mariani, and I hope I'm not butchering your name at all. But yeah, that's awesome that he was able to lift that and give you that insight there.
Wow, thank you so much.
Yeah. Our hours is really down to a close here. But is there anything else you want to share with us about your dad, and why this was important for you, or how we can all begin to cultivate some of these attributes he had?
So I guess this is the thing. I was not allowed to say I can't. And I think that's who he was. Don't tell me what you can't do, because there will always be naysayers. There will always be people, no matter what color you are, what creed you are, what gender you are, where your socioeconomic background is. There will always be people who will tell you you can't, and they've got their own personal reasons why they need to hold you back. But I say righteousness and goodness and justice will always be opposed, because it doesn't mean anything if you don't fight for it. So fight on, whatever that dream is in your heart, whatever that little sparkle is that says, I want to be a firefighter, and I'm a Native American female. I don't think I've ever seen a Native American female firefighter myself, but that doesn't mean anything. My dad would say, don't tell me what you can't do. You can do what you put your mind to, and the dreams that are in your heart are worth realizing. That's what I'd say.
And I think that is wisdom for us all. Wisdom for us all. Thank you so much for joining us. I'm so glad that we were able to have this conversation. I think it was rich and meaningful. And as I've read and like to say, Black history is American history, and it's history. And so I think lifting your dad's narrative certainly is taking that full circle as the first Black graduate of MCV's dental school in 1961. So 60 years this year. 60 years this year. Thank you so much, Dr. Booker. I really appreciate you being able to
Absolutely.
do this. And maybe we'll have more and do something else and get creative about what else we can do to always remember your dad and his legacy and what he stood for. And just, again, being the first and knowing that others were coming behind him. Thank you so much.
Thank you, truly. Thank you so much, Carlos.
Yes. Good night, everyone. Thank you so much.
Bye-bye. Thank you.